Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.
Well, good evening, everyone. I'm Mike Redford, and this is the follow-up. Coming up on tonight's show, what are some of the most pressing health concerns on your mind? For some, it's whether or not to take the COVID booster shot, along with the flu shot, and do we need to get vaccinated for RSV as well? While others are deciding not to get vaccinations of any kind. Aside from that, do you have concerns about our growing mental health problems, the increase in substance abuse, and disturbing numbers about infant mortality rates here in mid-Michigan? Tonight we have two county health officers addressing some of the biggest health challenges facing our community. But first, we would like to hear from you to help drive the conversation here on the follow-up. You can do that in a variety of ways via social media on Facebook. You can dial into our follow-up hotline to voice your opinion or suggest future show topics. And you can comment on YouTube as well. And if you'd like to watch any of our past shows, just log on to deltacollegepublicmedia.org. Now for tonight's show, we have two county health officers who've been on the show before, and they're back teaming up. Glad to have you here. We have Joel Strasz, the Bay County health officer, in studio with me. Good to see you.
Good to be here.
And dialing in virtually, Christina Harrington, the Saginaw County health officer. Again, nice to have you both back. So let's get after it. We have lots to talk about here. Let's start with vaccinations. This is cold and flu season. We're getting into it. Lots of questions from people, and I'm sure you get them every day. We have flu shots, COVID boosters. Now I guess we need to add RSV to this list. So kind of guide us through this. Do we all need all three, or is it a case by case, depending if your immune's down? Joel, why don't you start?
So let's talk about flu first. Everybody really should get a flu shot. It's generally recommended, even though a lot of people may not have problems with flu or may not catch flu every year, influenza every year. It's a good idea to get the vaccine, generally one shot. COVID boosters are out now. We recommend them for everyone, but especially for immunocompromised people, for seniors, for anyone that is generally concerned about their health. And there's three different options that you've got. So you've got Pfizer and Moderna, which are the mRNA vaccines. And then you've also got Novavax, which is kind of a new player. They were originally developed in the first Operation Warp Speed, but they've got a booster out too. The thing that's different about the COVID vaccines this year is that they were free before from the federal government. They were distributed to health departments and doctors' offices and pharmacies, but now they're no longer free. So we have to purchase them. They're fairly expensive for the mRNA vaccines, especially Pfizer, we know. It's about $113 to purchase per dose. Novavax is a little cheaper. It's about $90 per dose. But you definitely have some options. And we recommend that if you've gone through your initial series and you're 2 months past that and you're in one of those groups, that you go get your COVID vaccine. Now, RSV is a different thing. RSV is, I'm not even going to try to pronounce it, respiratory syncytial virus. It's a virus that can affect anyone, and for most children and healthy adults, it's just a minor cold. But for really young infants and for some seniors and immunocompromised people, it can be a pretty life-threatening situation. Both my kids had RSV when they were infants. Both of them went into the emergency room, and one actually spent a week because he had pneumonia because of it. So we really recommend, first of all, for infants, for families with infants, especially below the age of 3 months, and then even up to 6 months, that they consult their pediatrician to see if they should get it. If they can get it. We really recommend that. But it's not as easy. It's a weight-dependent dose, depending on how heavy the infant is. For adults, there are 3 categories. Obviously, number 1 is seniors, anyone over the age of 60. Number 2 is adults that are immunocompromised or have health conditions that make them more vulnerable. And the third group is pregnant moms and new moms, too, that are breastfeeding.
A lot there. I know, Christina, you can add to that. Actually, I'm going to stay on RSV for a moment here. I'm told it's like the leading cause of hospitalizations in babies. So getting your babies vaccinated for RSV is of high priority. We're also hearing that RSV vaccinations, we might have a shortage. I don't know if you can touch on that. Are enough moms to be or getting it for their infants or their
I
children?
think there's a couple different options with RSV, and so they actually can get the RSV during pregnancy as well. So if there's a new mom out there who's really worried about it and going to deliver during the respiratory season, that is maybe an option for the mom. And also, as Joel just mentioned, if they're younger than 6 to 8 months, then that's really sort of that window of when we recommend that, as we know that a lot of babies, once they're born, that antibody is carried forward for a couple of months into life, and so about that 6-month mark, so mom's antibodies start to fall down, and so that's when we see children more susceptible to an RSV. And as Joel mentioned, it can be really severe, and so it's just that time of respiratory season. These are the things and the diseases that continue to circulate annually, as flu does, as RSV has been. I think that we're just at a more situationally aware now, post-COVID, about all these respiratory diseases, and knowing that there's treatments and prevention strategies out there for families is important.
As far as the COVID booster, are you seeing more and more people saying kind of wait and see? I mean, a majority of us during the heart of COVID took the series of COVID shots because it was killing people, and people were scared, and we didn't have a shot for it. So there were a lot more people that were saying, yeah, I'm going to take it. We had some anti-vax movement there, too, in the midst of that. But now we've got this COVID booster, and some are going, waiting and see. The numbers aren't as high. Is that what you're saying, that maybe people are a little hesitant to get that booster? Go ahead, Christine. Go ahead.
The more medically vulnerable you are, the more likely you're going to try to obtain the booster. And then the more healthy you are, it tends to be more hesitant on it.
Right. Okay.
I think that it's a different lens that we're looking through, right? Because of during COVID and the height of the pandemic, people were really fearful, and because COVID was serious and it was novel, and no one really knew. I think you could probably go back to the first time that you speak to a person and they say they got COVID. There's always this element of uncertainty about how you're going to fare. And we're much further along than that, right? As we continue to see diseases that spread in the human population, obviously we start to build immunities, and we've seen changes in the COVID virus itself, right? We know that we've seen different variants. Well, things start to mutate, and we're seeing a lot less volatility with the virus, right? So we see that there's a lot less hospitalizations that are occurring, and it's quote unquote behaving like other respiratory diseases that we now see circulating, like influenza. Is influenza a serious virus as well that kills many Americans annually? Absolutely. And so that's the lens that we sort of apply when we're talking about respiratory diseases and influenza and COVID, that we need to think about it in the same context, but realize that, there is risk, as Joel mentioned, particularly for people who are high risk and vulnerable.
Right. So I'm going to move on to a different area. I think you guys did a great job on that. That was some big questions people were asking. Let's segue into important health issues impacting infants and kids, some of which came, Christina, out of the results of the Be Well Saginaw Community Health Improvement Plan from a couple of years back. I know Bay County faces many of the same issues. There were some rankings that came out of that. And one of those, Christina, Saginaw County has some of the highest infant mortality rates in the state. So talk to us about that. Why is that? And what are we doing to sort of move the needle a little bit?
Yeah, it's definitely been a statistic that we don't like here in Saginaw. Infant mortality really is about a baby who dies before his or her first birthday. So these are babies that are alive. They may be born with difficulties at birth, but it can be from day 0 from the time they're born and all the way up until right before their first birthday. So anytime we lose a baby in that time frame, that's considered part of our infant mortality rate. And the rate then is it fluctuates obviously year to year depending on how many babies we lose. And the rate is calculated based upon how many live births we've had as well. So it's kind of the numerator denominator that we apply to the formula, and that's what gives us a rate. Our rates here in Saginaw have historically been high for decades. We, at one point, I think a couple of years ago, were higher than the city of Detroit. We have come down a little bit, which is great. I think the city of Detroit's rate is a 13.7. Our Saginaw city rate is a 13.3. So we are just behind the city of Detroit in the number of babies that we've lost in that very sort of small. And when you think of the geography and the population that lives in the city of Detroit versus the city of Saginaw is a pretty large difference. And so it's very concerning to us to see the loss of these babies. And what we've been noticing so far this year, really unfortunately, is that we are seeing an increase in the number of unsafe sleep deaths. So this can be a large category, whether it's suffocation, unsafe sleep environments, asphyxia. There's many different factors that play into what an unsafe sleep death might look like. But we've had nearly 50% of the deaths so far this year that we've experienced in Saginaw have been sort of unsafe sleep related. And this is really the most concerning for us because those are 100% preventable. These are healthy babies that didn't need to die. And what we're trying to learn more about in our community is the factors related to that. How do we wrap our arms around our moms and our families to help be supportive in their care, to provide and making sure that they have a safe sleep environment. Many people, if you know that you have had children, when you leave the hospital, they make you strap your baby in a car seat. They don't let the baby leave unless it's strapped in the car seat on the way out. And because we want baby to be safe, right? When that baby is discharged from the hospital, we also need to make sure that babies have safe sleep environments when they get where they're going out of that car seat. So some of the work that we need to pay attention to is our cultural differences around co-sleeping, and just philosophies around that. And I'm sure we talk a lot with moms about the generational gaps and what we've done with babies. And so first it was, put babies on belly, then it was on the side, now it's on the back. And so I think there's a lot of mixed messaging around safe sleep environments. And so we're trying to do a much better job with education and bridging those cultural aspects and generational gaps around what constitutes a really safe sleep environment for babies.
Good. Well, you're attacking it. You know what you're dealing with, and it's a hard road ahead, but we have to educate and provide the resources, and so it's going to be. It takes some time to turn that around a little bit. All right, I'm bouncing around to a different one.
Okay.
Let's move on to substance abuse, and Joel, I'll let you start with this. Drug overdoses in this country topped 100,000 last year.
Yep. Majority
of those deaths, about 80,000, the result of the opioids, or should we say fentanyl, the synthetic version. Substance abuse of all kinds jumped during COVID, continues to rise. So, Joel, as a health officer in Bay County, what are we doing about it?
So it's been a big problem, not just regionally or nationally, but really here in Bay County and in the Saginaw Bay area. We saw the numbers go down kind of steadily up until about 2021, and then they raised back up pretty substantially. And it's just fentanyl. It's fentanyl. It's ubiquitous. It's in everything. It's not just, a lot of people think, well, people are overdosing from pills that they got from doctors. No, that is 10 years ago, and that pretty much stopped. It's not necessarily old school heroin. It's not people using drugs intravenously. It's kind of a variety of different means, whether it's fentanyl pills that are bought in the street, or intravenous drug use, or people using cocaine or methamphetamines that are laced with fentanyl. That's the big contributor. But more to that is we've got to start tackling of reasons why people are engaging in substance abuse. And a lot of old beliefs are being challenged. It's not like it's a graduated system where someone might start off with alcohol and then go to marijuana and then kind of matriculate up to their drug of choice. We're seeing polysubstance abuse. So, people can be dependent on alcohol and marijuana and opioids or some of these other drugs. The other factor into this, and one thing too that we've got to get a better grip on, is we need people to seek treatment and to engage in treatment, but we also have to really look at it as this is a chronic condition. Once you make it through the initial realm of treatment, you might be clean for a while, but that you're also at your most vulnerable point. And a lot of the overdose deaths that we see are with people that have stopped using. They've gone through treatment, or maybe they've gone cold turkey without it, and their tolerance levels are extremely low. But they still believe that they can use at the same levels that they did before, and those are fatal levels right there.
Right.
So now every county and just about every municipality has received or had a chance to receive opioid settlement funds. Those can be used over 18 years, and we're in the process right now of trying to determine how to best use those. But it's still, in comparison to the magnitude of the problem, it's not enough resources really to devote to this. And in the same way that, like I said before, that we look at things like cardiovascular disease, conditions that are chronic, diabetes or COPD, we've got to start looking at substance abuse in the same way. Those are chronic conditions that can be treated and managed, and people can live full and healthy lives, but it's not just a one-and-done thing.
Sure. Christina, can you add to some of that? I bet you can.
Yeah, I mean, we're seeing similar things as well. We're in the midst of part of our health improvement planning, as substance use is one of our health priorities, is to reduce fatal and non-fatal overdoses that we're seeing across our county. And so we've got some really great resources in place. We have quick response teams that go out and work with families who've experienced an overdose. They do follow-up. They do resources for the individuals and for family members. Our law enforcement community is very much engaged in trying to help individuals when they get calls and see overdoses, our EMS community. So we've got, I think, a lot of will in terms of being people at the table to talk about the partnerships that are needed to really create system level changes around harm reduction. And so I think, just as Joel was mentioning, that this is sort of a chronic condition. So people who use, we can't apply the same sort of abstinence only or cold turkey all the time with folks, because that's what we're seeing, an increase in the overdose, right? And as you just mentioned, so if it's a treatment program and they come out and they use the statistics on fatal overdose, it's like 26 times greater that they'll have an overdose upon leaving, like the jail, for example. If they're incarcerated for a period of time and not able, their body can't handle the same dose, and particularly when they don't know what's in it too. So that's what we're seeing. It's the street drugs that is increasing harm in what people are using, and pretty much everything has fentanyl in it now. So we've got fentanyl test strips, we have a Narcan vending machine, multiple ones now across Saginaw, and I think even now expanding upon that in the region to provide education and resources for folks, and really looking to reduce harm. And so even in Saginaw, we have a harm reduction program, which is syringe services and provides other mechanisms to reduce disease transmission and provide education for our residents who are using.
Okay, I'm going to bounce around to another one, because these are all important issues. Here's another one, the growing mental health crisis. Anxiety, depression, suicide, isolation. The statistics are sobering. Nearly 50,000 people in the U.S. committed suicide last year. People that need the help can't get it fast enough because we simply don't have enough counselors, therapists to go around. So, Joel, you want to touch on that situation in your county, and people can't get
Sure.
the help they need, and and the severity of the problem there?
Well, I think, obviously we came out of a very strange time period for the last 3 years that was very stressful on probably the whole segment of society. We see all sorts of conflict and isolation every day, whether it's on TV or people that are just kind of, we don't live the same lives that we did 20, 30 years ago, and in some ways we have a better sense of community than we did. In other ways we have a worse sense of community. And so it's difficult for a lot of people to cope, and they don't have the same support structures that are in place. And they also don't exactly know where to turn for help, or if they do try to turn for help, there's so much demand, there's just not enough mental health practitioners out there. And with all that being said, we have seen some increases in suicide. But I want to temper that too, because I hear a lot, like all these, there's a lot of teenagers committing suicide. And that's certainly not the case in Bay County, and I think in our surrounding area. But we're definitely seeing more suicides with older adults. When we dive into the data and take a look at it, these tend to be more isolated individuals that really need that social support network or that community support network. And that community support network should be able to at least provide them a path forward to treatment with a mental health professional. And all that being said, it gets back down to mental health is just like physical health. You've got to take care of yourself. We've got to be able to teach people how to decrease the stress in their lives,
right,
and have a healthy mental life as well.
That's what I'm going to say, and then Christina, I'm sure you can follow. There isn't a magic bullet to solve this problem, but we need to find ways that just deal with stress and isolation and anxiety before it gets to a point where I've got to take medication or see a counselor, right? So what's happening in Saginaw County there?
Right, as we know that, we're seeing a lot of anxiety and depression presentations at various providers. So that's what we're seeing, right? Which is sort of that first steps. And so there's still stigma associated with mental health. We're trying to do a lot in that space, that mental health is health. And it's just as you get a checkup annually with a physician, you should be able to get a checkup from the neck up type of concept. But yet we don't think of mental health services in the same lens. And we're really trying to peel back that stigma so that people are more comfortable taking that first initial step. We're also looking at creating tools, as Joel just mentioned too, about it really creating awareness about what we can do. How do we sort of de-stress our lives when we're all experiencing these things? And I think recognizing what we're seeing in ourselves and knowing what are those triggers. And so we worked with some students and some high school students to talk about their mental health, as we know that adolescent and youth mental health has also been really detrimental, I think, during COVID and that isolation that was created for kids. We're seeing the effects of that now in terms of how they're handling. And so we created a resource that's coming out just this week called a Mental Healthopedia. And so it's on our Be Well Saginaw website. It was really driven by students who said, sometimes I just need to know if what I'm feeling is quote unquote okay or quote unquote normal. And I know we don't like to use those terms when we talk about mental health, but they just want to know, like, is this something I need to do something about, or how do I cope? And so we have all this list of sort of feelings, emotions, and different concepts that it's just a tool that they can go to, look at how they're feeling, and then, like, what does it potentially mean, and what do I do about it? So some basic tools and resources that people, they can do. We call it self-care or self-help. In the mental health space, I think those are real options for people, but we need to recognize and know what our feelings mean, and then what we can do about them.
Are those some things you're working on in Bay County as well to attack this mental health problem?
Oh yeah, absolutely.
Yeah.
It all comes in like a holistic manner, though, too. Like we had said, like mental health is your physical health too. And while we don't have a structured or a formal organization like Be Well, we're moving in that direction. But mental health has always been a component of our community health improvement plans, and we work pretty closely with our local behavioral health agency. But in addition to that, the local hospital and substance abuse providers and local providers, whether primary care. That first, as Chris said, those first questions really shouldn't be from a psychiatrist's office about how your mental well-being is. It should begin at your annual checkup. And those are really structured questions that are pretty much universally done now, wherever you go. But we have to make sure that people are accessing a primary care provider. And that's one of the problems that we're having in Bay County is we have a shortage of primary care providers. So we've got to increase that number, attract more providers to the area, but at the same time engage people at the community level and make sure that they understand too that health is not just the absence of illness, it's your total well-being.
Right. And we're putting some information there the viewers can see, promoting the Bay County Health Department, the Saginaw Health Department, so if they have any questions, they can go to those websites. And you mentioned, we have a shortage of doctors, we have a shortage of nurses, we don't have enough counselors and therapists, and that's an issue from a staffing standpoint we're going to have to deal with. That's not going to be an easy thing. Last word, Christina, with about 45 seconds to go to wrap up our program tonight.
Just thanks for having us. The education, I think, is something that public health is continuously always striving for. As we just said, if there's a shortage in all these areas, there are things that we can do for our own health and well-being. There's resources out there for us. There's a lot of great work being done across the whole public health system partnerships, which is not just the health department, but all of the partner organizations that Bay and Saginaw are working with. Find those resources. If you have to start somewhere, start with the health department.
Very good. Well, Christina Harrington of the Saginaw County Health Department, Joel Strasz of the Bay County Health Department, thanks again. You made a good team. Nice to have you back on. Keep up the good work. Appreciate it.
Thank you.
Thank you.
And that's our show for tonight, but be sure to join us again next week for the follow-up. We'll talk about competing with Asia and others on microchip development, but are we really doing it? Two local companies are among the nation's leaders doing just that. That's next week, right here on the follow-up. In the meantime, hit me up on social media or dial into our follow-up hotline. We really want to hear from you. Thanks for joining us tonight. Have a good night. We'll see you next week.